Garcia. Hello, my name is Alvaro Garcia. My theme is uterine fibroids. What is the uterine fibroids? Uterine fibroids are non-cancerous benign tumors that develop in the womb uterus, a female reproductive organ. 1 in 5 women may have fibroids during their childbearing years. They are more common in African Americans than Caucasians.
Symptoms of fibroids. Uterine fibroids are very common in women of childbearing age, but most don't even know they have them, as the symptoms of fibroids can easily be mistaken for something else. In fact, 50% of women with fibroids have no symptoms at all, and only know they have fibroids during a pelvic exam or when they're having troubles conceiving. Here are some of the more common symptoms you need to be aware of, so you know when it's time to take action. Abdominal swelling. If your belly is bulging out, but it feels hard when you touch it, this is a common sign of fibroids. Many women with fibroids look pregnant when they're not, and find that the swelling gets worse over time. Heavy menstruation. If you find that you're constantly having to change your Super Plus tampons or nighttime sanitary towels during your period, this is also a sign that your fibroids are causing abnormal bleeding. Some bleeding can be so bad that blood transfusions are needed. Abnormal bleeding. In addition to heavy bleeding, you may find that you're spotting in between periods, or your periods are lasting 6 or more days of constant bleeding. Some women also pass heavy black clots in their menstrual blood. Vaginal bleeding after menopause. Women who have gone through menopause may experience bleeding after several years of not having periods. This is another indication that the fibroids are becoming out of control. Back pain or pain in the back of the legs. Women with fibroids sometimes experience pain in seemingly unrelated places. This is because the nerves that link the uterus to the brain are located quite near the nerves for the back and the legs. Cramps. Fibroids can cause strong spasms as the uterus recognises them as a foreign body that it needs to expel. It can feel to some women like they're going into labour, and the pain can be so bad that painkillers can't take it away. Pelvic pain. This can come in the form of a constant dull ache or sharp pains, depending on the type of fibroid. Some fibroids can compress other organs and cause them to feel under pressure as well. Urinary problems. Women with large fibroids may experience frequent urination as the fibroid presses on the bladder, or difficulty urinating if the fibroid is blocking any part of the urinary system. Frequent urinary tract infections are also linked to fibroids.
The cause of uterine fibroids is unknown. However, their growth has been linked to the hormone estrogen. As long as a woman with fibroids is menstruating, a fibroid will probably continue to grow. Usually it will grow slowly. Diagnosis. Fibroids are first diagnosed during a gynecologic examination. The presence of fibroids is most often confirmed by an abdominal ultrasound.
Present a case of a 4-year-old woman who had failed 2 previous attempts at hysteroscopic resection for a 4-centimeter intracavitary fibroid. As a result, she presented to us for a laparoscopic procedure. The hysterotomy is performed using monopolar surgery with continuous current, and this is taken down through the endometrium. The fibroid can then be visualized through the hysterotomy incision. The fibroid is grasped with a single fibroneculum and elevated and extruded out through the hysterotomy defect. The base of the fibroid can then be visualized and isolated and separated from the underlying tissues using endoscopic scissors and monopolar upper surgery. Once the specimen has been removed from the underlying tissues and the endometrium can be approximated, this surgery prefers a 4-layer closure in order to minimize or eliminate the risk of uterine rupture during pregnancy. Initially, the endometrium is brought together using fluoro vicryl in 2 layers, the first of which is running along the endometrium, and the second immediately superficial. Get the endometrium being visualized and sutured. Intracorporeal knot tying techniques is used for efficiency. You see that using robotic devices is really unnecessary.
Historical treatment. Laxatives, enemas, and phytotherapy were first given as treatments to relieve the distension and volume in the abdomen. A surgeon named Ephraim Midwell performed a laparotomy to remove the ovarian cyst.
This video has been produced to familiarize you with the uterine fibroid embolization procedure, UFE. UFE is a safe, effective treatment for fibroids that has been performed for nearly 20 years. It is one of several treatments that may be used to treat fibroids in the uterus. Uterine fibroids are non-cancerous growths that develop from normal uterine muscle cells. There are 4 types of fibroids that develop in or just outside of the uterus. Submucosal fibroids grow into the uterine cavity. Intramural fibroids grow within the wall of the uterus, and subserosal fibroids develop on the outside of the uterus. Pedunculated uterine fibroids occur when a fibroid tumor grows on a stalk, resulting in pedunculated submucosal or subserosal fibroids. All fibroids require a supply of blood to survive and grow. UFE takes advantage of this fact to target the fibroids. Uterine fibroid embolization is a minimally invasive procedure. UFE does not remove the uterus or the ovaries. A small incision is made in the leg to gain access to the femoral artery. A long flexible tube called a catheter is then inserted into the femoral artery. It is guided up the femoral artery and into the artery that supplies blood to the uterus, called the uterine artery. The catheter is then guided to smaller arteries that supply blood to the fibroids. Uterine fibroid embolization delivers tiny microspheres to the artery that supplies the fibroids, cutting off the blood flow, causing the fibroids to shrink. The tiny microspheres are injected through the catheter and travel through the blood vessel. Since the microspheres are more than 60 times larger than red blood cells, they plug the tiny vessels that red blood cells travel through to feed the fibroid. The procedure is repeated in the uterine artery on the other side to make sure that all blood supply to the fibroids has been cut off.
Cont. Hysteroscopy, a procedure in which a fiber optic scope is advanced into the uterus through the vagina and cervix. Uterine artery embolization, a procedure in which a Sycian injects small particles through a catheter placed in the uterine artery. Signs and symptoms: bleeding between periods, heavy menstrual bleeding, sometimes with the passage of blood clots, menstrual periods that may last longer than normal, need to urinate more often, pelvic cramping or pain with periods, sensation of fullness of pressure in lower abdomen, pain during intercourse.
Fibroids are common benign tumors of the uterus that can cause significant pain as well as abnormal bleeding. About 30% of all women may have fibroids. Most of them do not have any symptoms. This patient education program explains uterine fibroids and their causes, symptoms, diagnosis, and treatment options. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. The female reproductive organs are located in the pelvis between the urinary bladder and the rectum. The ovaries have two main functions. One, the production of specialized hormones such as estrogen and progesterone. Two, ovulation, which is the release of eggs that are needed for reproduction. The hormones produced by the ovaries are very important in keeping ovulation regular. These hormones also prepare the inner lining of the uterus to proceed with a pregnancy. When an egg is released, it goes down to the uterus through the fallopian tube, where it may be fertilized. If the egg is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. The uterus is pear-shaped. It is about 3 inches long and has 3 layers. The inner layer of the uterus is called the endometrium. As menopause approaches, periods become irregular and eventually stop. Menopause occurs when the ovaries quit making hormones and releasing eggs. When a woman gets pregnant, the fetus stays in the uterus until it is born. The uterus is able to expand greatly in size. The middle muscular layer of the uterus creates labor contractions, which cause the baby to come out. The lowest part of the uterus is called the cervix, which opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. The urinary bladder is located in front of the vagina and uterus. The kidneys drain urine into the bladder through 2 tubes called ureters.
Uterine fibroids, medically termed leiomyoma, fibroma, or myoma, but commonly known as fibroids, are benign, non-cancerous tumors that grow within the muscular layer of the uterus. Fibroids are composed of muscle and fibrous tissue, which give them a firm texture. Fibroids are the most common of benign tumors found in women. They usually occur during the middle or late